to call me King Bee. She liked to...
All right, fellas, let's be honest. Some of you can be a little bit shy when talking about sexual health with your doctors. Maybe you're just too embarrassed to talk about it all. Maybe it's a bravado thing. But if you, or ladies, your guy is having a sexual issue, it may not be normal, like the guy might think it is. And there's a very good chance, actually, that it can be treated. So joining us to talk about this important issue is Dr. Teresa Knight from Women's Health Specialist. Thank you so much for being here.
Thank you for having me.
People are watching and they're thinking, Women's Health Specialist, why is she here to talk about men's health issues? But we were talking before the show, when the guy is too embarrassed to go talk to their doctor about it, what happens?
He asks his girlfriend or his wife, his partner, to come and talk with me.
So you hear a lot about this, don't you?
Oh yeah, I sure do. I sure do. Because, you know, the men, it's not a very manly thing to do, to go talk with their doctors about it.
Especially if you're having some relationship problems of the physical kind, which we'll get into in just a little bit. One of the things on the men's health side of the equation that it seems like has garnered more attention lately than ever before is prostate care. Prostate health, prostate cancer. First of all, let's put a definition out there. What does the prostate do in the first place?
And I'm really glad that you said it right, because I hear a lot of prostrate. And prostrate
something different.
It's something different. That's when you're flat on the ground.
Exactly.
So, prostate is what we're talking about today.
Good point.
And so the prostate gland is a gland that is around the urethra, encircles the urethra, contributes to the seminal fluid, and because it's intimately associated with the urethra, it's a place where if it becomes inflamed, if it grows slowly over time, as prostates do, then it can cause problems with urination.
That's interesting. So it is involved in the reproductive process, but it seems to me in the media and commercials, etc., we hear about it more often in relation to difficulty urinating.
Absolutely, and that's because it does grow over time, and so this is a very typical problem of older men, that they notice that it's more difficult to start their stream of urine and that it takes them longer. And we see commercials about this often.
We do.
It's a very treatable cause. It's something, though, that the doctors can't treat unless they know about it.
Yeah.
So just know it's a very common cause and not to be embarrassed to go talk about it. It's also a gland that, of course, we hear a lot about because of cancer.
Unfortunately, yes.
Yes, yes, and that's the same thing. You know, if you live long enough, it's one of those cancers that you certainly can get. A couple of interesting things about prostate cancer, and one is that they're working on a vaccine for the cancer. So there are clinical.
You're kidding? That would be phenomenal.
Isn't that great? So there are clinical trials right now. So we may see that in the news before too terribly long. Contrary to popular belief, I have to protect the ladies. Getting a vasectomy does not increase the risk of getting prostate cancer.
So take that excuse off the table, fellas.
Yep. And since Valentine's Day is around the corner, the increased number and frequency of ejaculations does not decrease the risk either.
Got it. And you know what? Something I did learn from you too. This sort of floored me a little bit. If you have a family history of, on the women's side of your family, of breast cancer and ovarian cancer, your risk of prostate cancer goes up.
That is absolutely correct. Yes, and that's very, very important. Remember, those genes that cause breast and ovarian cancer are the same genes that are carried by men. And in men, what they cause is early prostate cancer. So if there's a family history of prostate cancer before the age of 50, that's something that needs to be brought to the attention of a physician.
Good tip. A little bit of a gear shift here. Now we've got to talk about what the fellas don't want to talk about. Erectile dysfunction, problems with those personal relationships. Is there any point where this is normal for a guy?
Well, you know, that's the problem, is that a lot of guys think, well, you know, maybe this is normal, it happens, I'm stressed out, I'm not getting enough sleep, and those things may be true, but, you know, there are also medical problems that cause a decrease in performance and a decreased interest in sex, and one of those things that we're seeing more and more of now is diabetes. And so if there's a decreased ability to perform, it may not be just because, oh yeah, you convince yourself you're not really in the mood, you don't really feel like it, but rather the inability because of something else metabolic going on.
And talk about the ability to treat a condition. I mean, we hear a lot about this in mass media too. There's a lot of treatment options out there.
Absolutely. You know, and diabetes is just one medical condition.
Sure.
Certainly there are heart conditions and heart medications that can affect performance as well. So it's very important to be able to bring that to light to the physician. And even if it is an issue of depression, that's something that's treatable. If it's an issue of desire, sometimes it will be because of low testosterone. And low testosterone can actually cause some serious medical problems, including bone loss. That is really what some people have referred to as the male menopause. And they can have problems with depression, memory loss, bone loss, fatigue, muscle wasting. And again, that's something that's very treatable.
Just a quick word, too, on another topic we just need to touch on, which is sexually transmitted diseases, especially guys out there that have a lot of partners, although that doesn't necessarily disqualify you if you're just with one person. What's the best advice you can give?
Well, the best advice, of course, is to be choosy. And then, of course...
That's good advice.
And then, of course, to use a condom. A word to the wise, condoms don't protect against all of those STDs.
Right.
The human papillomavirus, which we're seeing a lot of in the news these days, is what causes venereal warts. That's happy to live in the groin area elsewhere that are not covered by condom. Herpes as well. And both of those can be equally transmitted by oral sex as well. So we have to keep in mind that when we think about sexually transmitted diseases and sexual diseases, we have to think about oral sex and not just the traditional manner.
Absolutely. Hope to have you back soon to talk about the women's side of the equation, too.
Sounds like a deal.
But you're clearly an expert in both. So thank you very much for talking about these serious issues.